Should they be grouped together along with OCD? So first of all, let's take a look at trichotillomania, which of course is compulsive hair pulling resulting in hair loss. And research tells us that the person does experience an increase in tension before pulling or when trying to resist pulling their hair. They also get pleasure or gratification when they pull their hair out. And often they'll pull the hair out and then they'll play with the hair. They might drag it along their face to kind of tickle themselves. They might chew on the hair. Sometimes they might even swallow the hair. Sometimes they'll kind of play with it for a little while. So there's certainly some sort of gratification that they get from doing this. And in the same issue of the Journal of Clinical Psychiatry from this figure, Dan Stein wrote that, we should include trichotillomania as an OCD spectrum disorder because it involves repetitive behavior, just like OCD involves repetitive behavior. And in fact, the basis for much of the disorders that are included in the OCD spectrum is that they involve some sort of repetitive behavior or repetitive thinking. So it's repetition that kind of binds these disorders together, and they should be considered as obsessive compulsive spectrum disorders because OCD involves repetitive behavior. Let's look a little more carefully at that, though. So Christensen et al. And Stanley et al., there's been some research on the phenomenology, the nature of trichotillomania, and these folks found that the hair pulling is precipitated by tension. It might be precipitated by depression, might be precipitated by anger, even boredom, indecision, fatigue, loneliness. But there was no evidence at all that the hair pulling was precipitated by obsessional fear. So remember, in OCD, the person feels like they have to do these rituals to kind of quench some sort of a fear. I'm afraid that my hands are contaminated because I touched this podium, and I got germs on it from Christian. Not really. And so I got to go to the bathroom and wash my hands, and then that's going to make me feel better. People with trichotillomania, they're not pulling out their hair because they're worried that something bad's going to happen if they don't do that. They don't have the pressure to do it the way that folks with OCD do. Stanley et al. Found that hair pulling in trichotillomania leads to pleasurable feelings. We don't see that in OCD. People with OCD do not enjoy doing their rituals. It is a relief. Whew, thank goodness I got done with that. They don't enjoy doing it. They wish they didn't have to do it. It does not feel good. But here, we're talking about something completely different. Right? Here, there's pleasure or gratification that's often, not always, but often associated with hair pulling. And when people with trichotillomania report that they do feel anxious or guilty or depressed, it's usually because they have to pull out their hair. It's usually because this has become such a burden for them, rather than that kind of distress leading to doing these behaviors like we see in OCD. So in conclusion, although hair pulling in trichotillomania is repetitive, in the same way that compulsive rituals in OCD are repetitive, the hair pulling serves a different purpose. It has a different function than do compulsive rituals in OCD, which are designed to reduce a specific fear of anxiety, of some sort of obsessional fear of disastrous consequences. So trichotillomania is, I think, correctly considered an impulse control disorder and not an OCD-related disorder, and certainly not an anxiety disorder. What about other forms of impulse control disorders? Kleptomania, binge eating, compulsive gambling. And again, there's been some research done on these conditions as well, showing that there are no obsessions. There's no obsessional fear. They don't involve anxiety-provoking obsessional thoughts or images. Something bad's going to happen if I don't steal something. Something bad's going to happen if I don't gamble. People who go gambling, they do that because to them the activity is enjoyable. It's positively reinforced. And in OCD, we talk about compulsive behaviors as being negatively reinforced because they're escaping from some sort of a negative consequence, like feeling very anxious. And in fact, McElroy, again, in that same issue devoted to the OC spectrum disorders, back in 1995, wrote that people who have compulsive buying problems, they report a thrill or a rush when buying. Very different psychological experience, very different phenomenology than what's going on in OCD. Another problem here is compulsive sexual behavior. And my colleague and I at the Mayo Clinic, we did actually some research on folks that have been referred to our OCD clinic with these sexual compulsions, what are often referred to as they're called sexual addictions, I guess is the best term for it. And they were referred to us with the idea that they had obsessive compulsive disorder. But in fact, they didn't. They actually had these impulse control disorders. And so we decided to do a study comparing folks who had these sexual addictions, this impulse control disorder, to people who had OCD, who had sexual obsessions. So what are sexual obsessions in OCD? Unwanted thoughts, what if I molest a child? Or if I'm straight, what if I turn gay? Or unwanted thoughts about doing other kinds of immoral sexual behavior that the person finds unacceptable to even think about. And what we found, I think it's pretty clear, that folks with OCD are in green. They had a fear of their sexual thoughts. The sexual compulsive group, sexual addictions group, they didn't have a fear of their thoughts. In fact, they were aroused by their thoughts, whereas the folks with OCD, not the case. They were afraid of their thoughts. And people with OCD were avoiding triggers of sexual content, whereas not so for the folks who had the non-paraphilic sexual addictions. And what about getting enjoyment out of the thoughts? The people with OCD, no, I don't enjoy it. In fact, I'm even surprised that they even scored a 1 on their 0 to 7 rating. The people with sexual compulsions, however, they very much enjoyed having their thought. They often led to sexual behavior, right? That's what the definition of a sexual addiction. So again, the behavior is repetitive. The people with the sexual addictions were often engaging in sexual behavior. People with OCD were often thinking about sexual behavior. But just because of the presence of repetition doesn't mean that the same thing is going on from a phenomenological point of view. The sexual content had very different functions, very, very different. This one, for the OCD, it's based on fear. And for the sexual addictions, it's more based on sexual arousal and interest. Let's talk about Tourette syndrome and tic disorders. So Tourette's is another condition that involves repetitive behaviors. Here we have tics, repetitive motor or vocal tics you need to have Tourette syndrome. These are sudden, rapid, recurrent, non-rhythmic or stereotype movements. They can be vocalizations. The difference between tics and OCD, or compulsions in OCD, or rituals, is that tics are spontaneous, whereas compulsions are premeditated. They're deliberate. The person says, what do I have to do to get rid of my contamination? Oh, I got to go wash my hands. I'm driving down the street and I get an obsessional thought that maybe I hit someone with my car. Oh, okay, I got to get rid of that. I got to go back and I got to check. Very, very premeditated. They're very deliberate behaviors. Not so for tics, as we'll see in a minute from some research that was done. Tics also function to reduce sensory discomfort or tension. They're performed in response to what's often been called a premonitory urge, more like a physical sensation. They don't serve as an escape from obsessional fear. It's not like I have to do this tic in order to prevent me from going to hell when I die because I had some sort of bad thought. So tics serve a very different function. And Euripides Miguel and his colleagues at Mass General did a very nice functional analysis of OCD behaviors and Tourette syndrome behaviors. They looked at the antecedents, so what were the triggers of these conditions? And as I was saying before, in OCD, the triggers are in the cognitive, the affective realm. Some sort of anxiety, some sort of obsessional thought. For tics, it was more in the sensory realm. So some sort of urge to release energy or release tension. What about after you do the tic or the compulsion? What's the consequence? Well, in OCD, as we know, it's a reduction in anxiety, a reduction in some sort of a fear. In tics, it's more of, a release of sensory tension that doesn't often last very long. And then what happens if you try to not do a ritual or not do a tic? Well, people with OCD, their rituals are completely under their voluntary control. It might not seem like it. They might say it's very painful if I don't do a ritual because I'll be very, very scared, very anxious. But they can certainly stop their rituals. In fact, the most effective treatment for OCD, exposure and response prevention, involves them working on stopping their rituals. So it's something that they can do if they learn strategies for how to do that. For tics, however, it's very difficult, if not impossible, to prevent or even delay a tic from occurring. So again, I think we're talking about very, very different phenomena that are both repetitive. So as Christian's slide nicely illustrated, you can look at the topography of it and see these things are alike. But when you look more at the function of the behavior, I think that they're very different.